On Sunday evening, the Senate began the process of moving along with a spending plan that could end the government shutdown, but not everyone is happy about the terms of the deal. For this and more, we're joined in studio by Springfield U.S. Representative Richard Neal. Congressman, thanks for coming in today.
Delighted to be here, Adam.
A deal was reached between senators which would fund the government through the end of January, among other issues as well that would be funded. One key thing during the shutdown has been the subsidies under the Affordable Care Act. This deal would guarantee a vote on those subsidies in the Senate, but there's no guarantees of anything actually getting funded. I know that's something that a lot of Democrats have held firm on. So I'm curious to get your thoughts. Are you going to vote for this if it comes to the House?
No. I think there's a principle involved here. The principle with which we stood united was to enhance the opportunity for the consumer to purchase the tax credits and use the tax credits to make health care insurance affordable. That principle has been evaded in this so-called agreement at the moment. The Speaker has made no guarantee that he's going to bring a measure to the floor that will allow for an up or down vote on the premium tax credits. And the reason for that is because a lot of his members who are in purple districts, they will be forced to have to vote for them, or if they vote against them, to explain it back home why they chose to deny 24 million Americans consumer opportunity with affordable health care. I think that the position that has been adopted here in short order lets the president off the hook. He never really engaged other than to post from time to time on Truth Social a position that was largely untenable. Republicans and Democrats both understood that. But the fact that he never really engaged with us in a real meaningful negotiation means that I'm a hard no.
And as far as the 8 Democrats in the Senate that joined the Republicans to make the 60 votes needed to start this process, does that give you any concern about any fractures or fissures in the Democratic congressional field?
I think the House Democrats are likely to hold their position, but recall, even with the swearing in of Congresswoman-elect Grabala, that will still bring it to 219 to 214. So they conceivably could pass just about any measure they want, or simply accept the language of the Senate and proceed on that basis. That still doesn't imply, suggest, or mean that they have to bring the measure to the floor based on extending the premium support tax credits. This was the pivotal issue for us. This is not about anything other than providing the American consumer with some certainty as to what their health insurance costs are going to look like. 24 million people are going to witness an increase in their premiums. 4 million people are likely to opt out of the system when they see the increases, for sure. And recall that when the ACA was written, the idea was that a lot of people who weren't crazy about the issue necessarily, crazy about what we were doing, understood it was a huge step in the right direction. And we opted for the whole idea about universal access. And with universal access, that meant that the hospitals would play a role. So instead of people using the emergency room for health care, knowing that they had either expanded Medicaid or they had enhanced premium credits, that they would be able to use a regular doctor's care in a timely manner.
Now, is there any way to, if this deal does end up passing, is there any way to try to work on those subsidies in a different channel, perhaps?
Well, I think that I have suggested time and again that, first of all, as you know, I rejected the idea of a one-year extension, largely because I thought we'd find ourselves back 1 year from now where we are at the moment. But I was open to the idea of 2 years, 3 years, and then let's take a look at how the tax credits play out. Some of the critique has been that there are people that are very wealthy receiving those credits. I haven't seen a lot of evidence about that yet. But if that's the case, let's have a separate discussion and negotiation after we fulfill the mission statement of the ACA, and that was to provide universal access. It's extraordinary with what we were able to do from the high point of those in America who did not have any health insurance to where they are now. The number I gave, 24 million more Americans have health insurance because of the ACA.
And as far as people that have been dealing with the direct impacts of the government shutdown, the SNAP benefit situation, which we'll get to in a moment, federal employees who haven't seen a paycheck in quite some time, people who maybe are just trying to fly from point A to point B, hearing that the shutdown may be coming to an end could be seen as good news. Also, there's been a lot of frustration amongst these folks. What's your message to them?
I agree with them. I agree with that frustration. And at the same time, we want to make sure that the government does reopen. It should never have been closed. Reasonable people should have been able to conclude a negotiation. That's all that we asked for, was a negotiation. And if your closing position is the same as your opening position, which the Republicans held on to, that's not a substantive negotiation.
This deal would fund the SNAP program, which has been in the news quite a bit through the end of this fiscal year. The Trump administration on Monday went to the Supreme Court after another legal setback on Sunday, looking to appeal this decision from a lower court that they had to fully fund the benefits through the end of this month. Of course, if the shutdown is resolved, this kind of becomes moot. But why is the president's administration fighting having to fund SNAP fully right now?
It's a great question because he was wrong twice. He was wrong on his initial position, which was a bad policy statement, and then by deciding to appeal the federal court position to the Supreme Court, he was wrong on the politics of it as well. Now people have been able to discern exactly who is to blame for the SNAP benefits being compromised. Consider the following, that 42 million Americans receive SNAP benefits. I thought that the Springfield Republican yesterday did a terrific job of reminding people of who exactly derive SNAP benefits. When you look at some of the suburban communities around Springfield, one might conclude, well, these people by and large are pretty well off. And then when you see the number of families that are receiving SNAP benefits while they're working, you understand just how far-reaching the SNAP benefit is. So I think that the president, who has a predilection, if I might say, to double down when he's wrong and then to try to change the subject afterwards, he clearly bears responsibility for the SNAP benefit debacle that we have now. And I want to thank Governor Healy for proceeding to fill the vacuum.
It was a busy weekend as far as news coming out of Washington. The president also announced that he's pushing for a so-called $2,000 tariff return, basically, rebate to residents. I'm curious to get your thoughts about this. Is this even fiscally feasible?
Well, it certainly adds for the debt, I can tell you that. Look, the tariffs haven't worked. Targeted tariffs, the threat of tariffs, that's a decent policy position. But the implementation arbitrarily of these tariffs, in some cases 50% on Brazil. What he's done with Argentina, $40 billion currency swap, causing the Chinese then to buy their soybeans from Argentina rather than American farmers. The consumer is paying a higher price. That was amply evident in last Tuesday's elections. Sherrill won by 13, Spanberger won by 15, Newsom 2-1 in California, Mamdani in New York City. It was about price. It was about the ability to pay for the items that you need in terms of sustenance every day. So I think that when you look at the president's position on tariffs, he might be the last one to believe it.
And finally this week, former House Speaker Nancy Pelosi announced that she would not run for another term for her California House seat. First woman speaker. I know somebody you've worked very closely with for a long time. I'm curious, what's her legacy going to be in Washington as she gets set to depart at the end of her term?
She knew how to get legislation passed. She understood the arguments that you make in public. She understood what demonstrators might do. She understood the noise that might be created for good reason to get people to have their attention drawn to a particular issue. But she was a legislator. Legislation changes lives, and that's precisely what she did. When you look at the Affordable Care Act, let me tell you, she was the vote counter in the House. I look back at what we did with the Butch-Lewis Act, the Infrastructure Bill, the CHIPS Act, the CARES Act. We never negotiated the CARES Act with President Trump at the time. We negotiated it with Secretary Mnuchin. The two of us with Mnuchin went back and forth. We got the CARES Act done. Then we got the American Rescue Package done. And the two of us are standing outside the Oval Office waiting to see Joe Biden. And I said, Madam Speaker, I'm putting the Butch-Lewis Act in this legislation. And she said, go for it. Walked in, told the president I was putting it in. He goes, I agree with you. The two of us looked at each other, quietly winked, and 2 million people tonight are going to get a good night's sleep because they played by the rules their entire lives, and we restored their pensions. She was a masterful vote counter on the inside, a great advocate, and by the way, only happy from time to time to tell her own side she disagreed with them on strategy.
U.S. Representative Richard Neal represents the 1st Congressional District of Massachusetts. Congressman, thanks for coming in today.
This is terrific. Thank you, Adam.
This is 88.5 NEPM.